Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, attorney Kim Hegwood of Your Legacy Legal Care, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and again, our very special guest, Luke Sanchez with Concho Hospice. We were having such a good time with Luke last time that we know he had tons more stuff to say. So last month,
Absolutely.
we talked about what hospice is and what it's not. Always good information because I know when I was 20 years ago, I had unrealistic expectations of what hospice really was. What are the non-negotiable qualities families should look for when evaluating a hospice provider? Really, really good stuff. So if you didn't listen last month, catch that one so you catch this one. And then the last thing we talked about last month was how can families assess whether a company has enough nurses, aides, and after-hour support to truly meet their loved ones' needs. Now that was really, really good stuff. So catch episode 1 last month, and now we're going to do episode 2. And I'm like, Luke, is so glad to have you back so we can finish up such good stuff today. So I appreciate that immensely. And
Absolutely.
um and so let's kind of dig in a little more. And in hospice is supposed to be very patient centered, right? All about the patient. But not all companies operate that way. So what questions can families ask to uncover a provider's real philosophy, care, not just their marketing language? How do they, not just the fluff, but what do they really do?
Yeah, absolutely. So, one thing I like to tell families is every single hospice you ever talk to is going to tell you something along the lines of, well, we treat everybody like family. But what does that actually mean? Because I have family I don't like and I don't treat them. So, with that, you what you have to understand is what does their what, uh, what is their philosophy behind that? When they say I treat everyone like family, what does that mean? What does that look like? What do you know what I encourage families is you need a hospice where you're going to have the nurse's number. You're going to have the CNA's number. You're going to have the social worker's number. None of this, call the office and someone will call you. That's when you have nurses that are way, way, way overwhelmed and they can't field the calls coming in. What you need is a dedicated team. So our philosophy at Concho Hearts is we treat the person, not a diagnosis. What does that look like? So treating the person means it's not about throwing pills at them and hoping that they could just be a zombie in bed and everything's cool and we don't have to worry about them. What we focus on is quality of life. What I like to tell my families is I want the rest of their life to be the best of their life. I want you to no longer have to stress over, is mom or dad okay? Is grandma or grandpa okay? I want you to focus now on being their loved one. I want you to focus now on being present. Our doctor, and this is a big thing that matters, our medical director, he's really big about interventions, thinking outside the box. That's important because you can have the greatest nurse in the world, but they're not the actual prescriber, the doctor is. That's really important to understand. Who is your medical director? Google them. Like my medical director, for instance, Dr. George Valdez, very, very, very smart geriatric hospice provider. He runs a geriatric practice, he runs a palliative practice. His whole world revolves around understanding the needs of the geriatric population. And he is really big about interventions. He's CURT certified. What does that mean? He can do medical THC. He can do interventions that are outside of just your typical narcotic to make them a zombie because we want to focus on quality of life, not just get them quiet. That's important because, again, greatest nurse in the world and they have the best heart in the whole wide world. But if their doctor's like morphine, everybody gets morphine, just put them on morphine, do morphine, more morphine, more morphine. What kind of quality? Let me back up for a second. For some people, that is exactly what they need. Don't get me wrong. But you need to understand when it comes down to it, kind of like what we talked about last time, on the good days, everything's good and everything's cool. And the nurse can be in there and you're loving them. It's on the days where things aren't going like you planned. What is that going to look like? If you have a loved one that's dealing with especially any type of senile degeneration, Alzheimer's, dementia, Lewy body, Parkinson's, we're going to see changes in their behaviors. What are we working on to make sure that they have quality of life? We could take care of anxiety. We could take care of those moments where they kind of lash out without turning them into a zombie. So again, you want a hospice, not to toot my own horn, you want a hospice that's going to treat a person, not a diagnosis. They're going to look at the whole picture. They're going to look at interventions outside of just medications. What kind of resources do they have to help you guys when you need it? When mom or dad was really active with this group or they were a veteran, church was their world. What kind of resources are you going to get to help give them that life, to help give them that world? One of my strongest points with hospice is I didn't come from a hospice background. And when I got into hospice, I realized really, really quickly that we are working with a generation of people who their world was not like ours. Their lives 30, 40, 50, 60, 70 years ago were not like ours today. How are we going to give them quality of life back? One of the things, being a chaplain, I looked at is, church used to be their social world. Everybody. It doesn't matter how religious you were. Church was your social world. Potlucks, friends, everybody's at church all the time. That's where your friends are. So how can we give you that world back? How can we help you feel comfortable right where you are? And that plays into everything. The CNAs, what's the CNA doing? Are they coming there just to spend time, shower you off real quick and get you back into your chair? Or are they spending time with you, making you feel good, making you feel pretty? Everything. It all boils into that. What kind of care are you getting? If they say I treat everybody like family, they're lying to you. You got to understand what that means. What is treating everybody like family? You need to understand, like, what does that equate into? So again, like for us, we treat the person, not a diagnosis. We're looking at them as an individual. We're looking at that family as an individual. This also goes into what nurse gets assigned to that patient, what CNA gets assigned to that patient. Every hospice has a lot of nurses. Doesn't matter how big or small they are. They have more than one nurse. They have more than one CNA. And are they going to work to make sure that you have a team that is going to fit your dynamic? Because, as much as we would like to believe everybody is for everybody, that is not the case at all. It's just like any profession. When you need an attorney, not every single attorney is going to be the perfect attorney for you. When you need anything like that, you have to find the one that's going to click with you. And
Well, I
so,
don't know, Luke. I think I'm the perfect attorney
no,
for
you
everybody.
are. You're the
So,
exception
I
to
just
the
wanted to
rule.
say,
No. You are the exception to the rule. But no, you understand what I'm saying, of like,
yeah,
they have to believe that you're going to, in being an attorney, when a new prospective client comes to you, they need to believe that you know what you're doing and you can handle them. They need to believe that you can see what they're dealing with and you can see the outcome of how to get past it. And it's all about that of, they have to, you guys have to be able to fit together.
yeah,
Absolutely. Because I'm sure you've dealt with clients, and we have too, where it doesn't sync.
yes,
And try as hard as you want and say all the right words and all the right answers. If it doesn't sync, it's a struggle. And so you want to make sure that the hospice is going to work to find the team that is going to really, really work with you. And that's important. You want your loved one to have a nurse that they feel comfortable with.
right.
You want them to have a CNA. Like I have a male CNA because some of my male patients, their families want a male CNA. So I have one because, different strokes for different folks.
Hmm.
And I want to make sure, especially when it comes to shower time, that's you are vulnerable in that position. I want you to feel comfortable.
I'm
So
not
it's
sure I'm going to feel comfortable either way. So, I don't know. I'm not sure I'm comfortable either way. So,
I'm here with you on that, because like my wife, she started out as a CNA, and she always says, "Well, don't worry, I'm younger than you, so when you get old, I'll take care of you." And I'm like, "No, you're my wife. You absolutely cannot take care of me."
and so yeah, that's what happens. You marry younger. That's what we tell guys when they get younger wives. So like, oh, that's great. Now you got somebody to take care of you when you get older. So.
Absolutely.
All right, well, let's talk about communication. So, communication is often the biggest complaint families have. Lawyers have the same problem, so we try to be as proactive as we can about keeping clients informed and up to date and things like that. But what should families expect in terms of updates and responsiveness and involvement in decision making, and how can they spot red flags early?
Absolutely. So with this, I mentioned this last time, and I'm going to reiterate this. And for those of you that didn't hear episode 1, go back and watch it. But
There you go.
the very first thing I would ask any hospice that I'm talking to, what is your on-call number? And I would call that number at 5:01 p.m. on a Tuesday and see what kind of response you get. Because again, your daytime stuff, you probably have the nurse's number, everything's good, you got a whole team working for you. It's the after hours chaos that you got to mitigate. I would ask them, what kind of communication? If I want to be here for every single visit, any person that sees my loved one, can we do that? If I want you to call me after every single visit, CNA, social worker, chaplain, nurse, doesn't matter. Anybody that sees my loved one, I want a phone call. Can we do that? I want a weekly text. Give me an update. How's my loved one doing? Maybe I don't live right here. Maybe I can see them as I can, but I still need to know they're okay. So what you want to do is set up expectations early on. This is what I expect. I've had families where they want the case manager, the nurse, the main nurse, to send them a detailed email or call them and give them a detailed rundown of everything: blood pressure, temperatures, oxygen, everything. They want to know. They want to know any changes. Are they eating less? Are they sleeping more? Everything. I've had families that say, I need you to call me ahead of every single visit because I'm going to be camped right there waiting, and I'm going to be asking questions. I'm going to be watching you. I've had other families that are like, just call me if there's something I need to know. So you need a hospice that is going to cater communication to what you are looking for. Because again, just like we just talked about, not everything fits everybody. Everyone's looking for something different. You and I might have different views on what kind of communication we would want if our loved one was on hospice. Do you want to be there every single time? Do you want a phone call afterwards every time? Do you want a weekly text? Do you just want to be notified when something changes? You want a hospice that's going to build out communication around that. You also need a hospice that's going to give you a dedicated nurse, because when it comes to decision making, as the decline begins to as the decline continues, and you have to start making decisions. What are we going to do? Is it time to, take them off certain medications? What is this going to look like for us? You need a nurse that is going to essentially hold your hand and walk you through that journey. We talked last time a little bit about just the hospice being the peace and the chaos. You need a dedicated nurse that is going to give you the time to make sure that you feel like you have all of the information you need. They're going to give you input. They're not going to make decisions for you. They're going to be able to give you input. These are your options. This is what we can do. Here's some things that we could try. But you also need a hospice that's going to empower you to make your own decision. I've met with families before where they felt like the hospice just kind of bullied them into everything. You need to do this. Now do this. This is what needs to happen. And the family's going, wait. Why? Explain this to me. Do you have a nurse that's going to sit down and talk to you about this stuff and go, hey, look, I'm going to walk you through every step of this together for the next 6 months, for the next 6 weeks, for the next 6 hours, whatever that time frame looks. We're going to walk through this together. I'm going to explain to you what's going on. I'm going to help empower you so you are not caught off guard with this. This, somebody passing shouldn't be a scary thing. It should be a beautiful moment where you're able to be with your loved one. And you need a team that is going to reinforce that. And so when it comes to updates or expectations on communication, this is something you need to share with the hospice, and ask them, is this something you can do? And if they say, well, our nurses typically send out, weekly texts, or we'll call you if something, no, no, no. You need a hospice that is going to really cater that communication to what you're looking for. When it comes to the decision making, you need a hospice where your nurse is going to be there, and they're going to educate you, and they're going to walk you through these things. We've had patients where they're, because of dementia, and dementia it's such a complex disease. We can have behaviors, we can have anxiety, we can have no more sleep or sleep all the time. We can have all kinds of things. And, if a family is dealing with their loved one has that, you need a nurse that understands that can walk you through this, that can explain these things to you. My nurses spend so much time educating the families on what's happening. So that way, when I go see them as a chaplain, or one of my other teammates sees them for their discipline, the family is empowered, understanding this is what's going on. This is the stage we're at right now. These are the things that are more than likely going to start happening now. My nurses paint the picture of what's coming next as best as they can. So families aren't calling going, oh my gosh, what's happening? I don't even understand this. What's going on? We want to empower and educate these families. And that is all down to that communication, because you can't make a decision if you don't have all the information, if you don't know what's going on.
So, I've only had one personal experience with hospice, and it was over 20 years ago when my grandmother declined. One of the first things I can tell listeners is we waited too long to call hospice. I think we should have done it a lot earlier, but I didn't know any better then. Now I know better, So, um, my mother and her two sisters, and my grandfather were all 24 hours with her the last week, easy. And I was in and out because I was still doing a lot of court work, so I was in and out. And but one of the things that I think my grandmother needed me to tell her was that my grandfather was going to be okay because I was going to take care of him. And she seemed to be at peace at that. And so, in a lot of things, when you talk about faith and personal beliefs, often impact how, families, how they do at end of life decisions. And so why do you think it's important for a hospice company to align and genuinely respect a client's faith and spiritual needs? I mean, I know the answer that I would want to hear, but I'm curious to see briefly what you want, what your
Yes,
ideas are.
this is an awesome question. So when it comes to respecting and aligning with faith, I have myself and two other chaplains on my team. Most hospices will have 1 to 2 chaplains. And I view the chaplain role, and I'm a bias in this, being a chaplain. This is one of the most important roles ever, because when it comes to your loved one dying, having somebody that is going to be there for your emotional support and your spiritual support, that outweighs everything. When medication is done and you are saying your goodbyes to your loved one, you want somebody that is going to be there to be the strength for you, to help you get through this. It's so hard as it is, having to lose your loved one, having to say your goodbyes. But if you could have somebody that is going to be there, be the strength in the room for you. So as a chaplain, it is not evangelizing, it is not preaching, it is not biblical teaching. It is a ministry of presence. I have had patients who were Buddhist. I've had patients that were Islamic. I've had patients that were everything under the sun. And I've had Christians, and I've had Catholics. I've had Mormons. I have had everything. My job as a chaplain is not to go in there and evangelize. My job as a chaplain is to go in there in a ministry of presence and to support you right where you are. When you are dealing with your loved one dying, you don't need me coming in there and preaching to you. You need me coming in there and hugging and holding your hand and reminding you that everything's going to be okay. Reminding you that your loved one knows that you love them, and being here right now in this moment is the absolute most important thing for them. Reminding you that your loved one may not be talking to you, but they hear you. Your hearing is one of the last things that goes. Just talk to them. Being a chaplain, I take pride in that because I have seen amazing situations. I've met with people at death's doorstep and I've sung songs and they'll start singing with me. I've met people, and I'm not at all trying to get preachy in this, but I've met people that I'm in the room with them and they're near the end. I had one lady about 2 years ago, and she goes, "My grandfather keeps coming in here. He's bringing me flowers. He's waiting for me. My grandfather, he keeps coming and checking on me." This lady was like 90 years old. Her grandfather has been dead a long time.
Mm-hmm.
But and any hospice person that you watch on Instagram or TikTok or YouTube, anything else, they will tell you the same thing. Death can be such a beautiful, beautiful journey. My job is to hold your hand while you hold your loved one's hand to that journey.
Mm-hmm.
I'm the escort to the pearly gates. And I'm telling you, a hospice that sees that psychosocial chaplain support as important will change the game. They can turn tragic situations into beautiful moments because it is all about being present, a ministry of presence. I am there for you, whatever that looks like. I had a family, this was 4 or 5 years ago. And as soon as I got to the door, this was my very first visit with the family. Because when somebody comes on hospice, so everybody knows, your nurse is going to be the first one that comes out. They're going to do an evaluation and an admission, admit you onto the hospice service. Then you're going to have the social worker and the chaplain call you because they want to come and meet you and they want to see how they can support you. So I go to do my chaplain assessment, and the husband meets me at the door. And he says, "I got to tell you, if you pull out your Bible, we're going to kick you out. If you start praying, we're going to kick you out. If you talk about God, we're going to kick you out. I'm not sure why you're here, but we'll let you in. But if you talk about religion, we're kicking you out." And I said, "No problem. That's all good. I'm not a problem in the world. I can just have a great conversation." And I went in there, and I will never forget this family. They're part of my heart now. They were weary. They didn't know what is a chaplain doing, because if you're not of Christian faith, oftentimes, and even if you are, what do I need a chaplain for? But I just started talking to them, understanding their life, understanding their world. And I asked if I could come back, and they said sure. And so I went back. And when I went back, it was much of the same, but they were a little more open. And then I went back again, a little more open. I went back again, a little more open. By the end, I was with the patient, and she didn't have a lot of time left. And by this point, I had visited them 5, 6 times. I had gotten to know them pretty well. And I asked her, I don't want to impede and I don't want to make you feel uncomfortable, but, you know, I'd like to pray before I go. Is that okay? And she asked me to pray. And I wasn't forcing anything. A chaplain's job is to meet somebody right where they are and assess their spiritual and their emotional needs and help them feel as comfortable as they can. The patient as comfortable and supported as they can through the end. The loved one as comfortable and supported as they can to the end. Whatever that looks like. Again, it's also important to understand the hospice is going to respect your faith. And I know I'm long-winded and I'm trying to wrap it up on this section, but my family that was Buddhist, the son was actually a Buddhist monk. They would let me come and talk, and that's all we did. We talked. We had great conversation. I respected at the end as well how they want the death to happen. what they want to have happen, how the body needs to be presented, how it needs to be there. And so that's important because you need to make sure that that psychosocial, spiritual, emotional component is going to meet you right there. Just like we talked about with the nurse, they're going to meet you right where you want them to be.
And that's perfect, Luke, always, so you may be long-winded, but boy, you have a lot of good stuff to say. And I kept thinking earlier, we tell clients, that, we do treat family. Uh, and so we do treat, we want family like the ones you love, so, and because I have some families I'm not real crazy about either, so I can appreciate that. But you know what, the good Lord has blessed me in so many ways, that I can't complain about the other. It's been the things that have occurred have been extremely good teaching moments. And so you always try to do better. So Luke, if somebody wants to find you, how do they find you?
So you can find me on all social medias, Rockstar Sanchez. Our hospice is Concho Hospice Houston, but we're all over Texas. So you can type in your city, and I promise there's one that populate. You can also reach out to me via email, lsanchez@conchoheartshospice.com. You can call or text 832-450-1118. If I can't help you here local, I can plug you into resources. Remember, you are not going through this journey alone. There are people out there that are specifically educated and designed to help you, and I can guide you to that.
Definitely. Thanks so much. It's been such a pleasure to have you on the show, and we look forward to having you on again soon.
Thank you.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.